Shaneez was diagnosed with very complicated medical conditions when she was 18 months old, where she should have been, walking and crawling. She wasn't doing all of those things. I was devastated. At the time, I thought I would lose her. That's when I wanted, more care. The hours increased. From 2 hours, I got 4 hours, and then it gradually went up to 6 hours. It was just not working at all. Shaneez was just being passed on from agency to agency. We were just being dictated to. It was not about understanding the patient and their needs. You never knew who was going to show up on your doorstep. It was confusing for Shaneez, and for me, it was like having your privacy constantly invaded. You didn't have the same people. Shaneez would get stressed out, which would cause her to have epileptic fits. Shaneez and myself were spending more time living in hospitals than we were doing in our own home. Personal health budget is a budget that are given to patients like Shaneez that have got ongoing medical conditions.
Over the last year, Newham Clinical Practitioners Group, the CCG, has started to look at personal health care budgets, and so in a small number, about 5 patients, has talked to the patients about whether they would like to manage the budget themselves. In Shaneez's case, there seemed to be poorer health outcomes, so there were numerous attendants at the A&E department, which often is a reflection that there's things not going well with the preventive health care.
The whole purpose of the budget is to have more control and more choice and more flexibility towards the services and the care that you need.
The idea was to see whether giving some more control over who was employed and the continuity of the staff would actually improve things for Shaneez.
Shaneez is able to choose the people that she's happy to have around her. We now have a team of 6 people. They're committed to working with Shaneez. Shaneez has got to know them in the last year. She's also been able to access a lot more of therapies. I've been able to employ a massage therapist. We've been able to do a lot more social activities, go out to the cinema. We've been able to do so much more with her. It's a bit daunting at first.
It's a new thing for carers and individual patients to manage these sums of money, so a lot of support's needed. I think what we're hoping to do is to make their lives less stressful and happier.
In the last year that Shaneez has had the personal health budget, she's not had a single hospital admission.
There are great pressures on the A&E department here in Newham and across East London, so anything that reduces the pressure on A&E departments is of great importance.
Anybody thinking about a personal health budget, I would say go for it. It's the best thing, that's ever happened to Shaneez and myself. As a family, we could smile again.